My name is Judy Gichoya. I'm an assistant professor at Emory University. My clinical work is an interventional radiologist who also works in informatics. I co-direct a lab here called HITI, and we work at the intersection of translation and innovation informatics. We are centered on the ethos of interdisciplinary work, where we merge computer scientists and clinicians, and we both learn from each other to speak one language and to solve bold problems. So our work with the Mirai team at MIT is really to advance the work that they have done for prediction of breast cancer risk. Using machine learning and centered on just understanding some of the pixel values, which just means the imaging characteristics within the mammograms, and then using those to predict what's the risk of breast cancer. And saying, here is your 1-year risk of breast cancer, here's your 2-year risk, here's your 3-year risk. So really an advancement from prior risk model. We are focusing on not just saying, here's a tool, we're going to try and run it on our own data set. From there on, we'll be able to validate it and even rebuild some of the new things, so that when it comes to a new institution, that it's going to be more representative and work for most of your patients. That's the value that we're adding to this collaboration, trying to test it on a new population, but also figure out how does this fit into the clinical workflow. So at Emory, we have not just the mammogram data, but also the pathology data. So we are, like I said, we're very interdisciplinary. We have radiologists, we have pathologists, we have breast imagers, and also computer scientists. And so what you can expect from our work is that we will completely test this, and especially on the African American females. But for us, we are in this learning mode, and can only be grateful for the institution where we work and our collaborators and our patients who allow us to learn from them.